This is the first in a series of lectures on wellness, extending health span, and use as the course for medical weight management. The topics for today's topics, we're going to go through epigenetics, going to talk about genes and what influences genes and genetic expression, talking about the obesity epidemic, the 6 factors of wellness, and then for the course that is being taught, how to write the book and getting started. Taking care of yourself first is the most powerful way to begin to take care of others. Many people taking this course are getting prepared to do physical therapy, PA school, medical school, nursing school. In all of those situations, the most important thing is to learn to take care of yourself. And so that's what really we're going to emphasize in this course. So we're going to use the most recent scientific literature to explore some of these topics, make some of these evidence-based conclusions and recommendations. And then throughout the course, it's learning how to express yourself, how to write down all the evidence that's been found in very clear format. Looking at mortality rate, and turns out to be a J-shaped curve. Turns out that being really, really thin is not an advantage to improving your lifespan. There's actually a sweet spot, and it's around a BMI of around 24 or so, right in there. Too much less, too much weight, underweight, you start to become immunocompromised, can't fight infections. And then on the other end of the spectrum, too much excess adipose tissue leads to inflammatory diseases and kind of autoimmune diseases where you overreact, like a cytokine storm that happens in patients that are overweight and catch COVID-19. So there's a sweet spot. And the topic of this course is really finding a way to get to that sweet spot and all the factors that impact trying to find that spot. Looking at the weight trends over the US over the last years since 1960, it's been increasing, but not at a gradual rate. It's been actually exponentially increasing since 2010. Projected by 2030, 70% of Americans will be significantly overweight. Right. So whatever field of medicine people are going to go into, they're definitely going to be taking care of patients with BMIs greater than 30, which is the definition of obesity. So the first question, in your opinion, what is the largest contributor to the obesity epidemic? Is it lack of exercise, hormonal imbalances, bad food choices, or genetics/epigenetics? The answer turns out to be genetics and epigenetics. So all these factors increase the risk for obesity, not only the types of foods you choose, sedentary lifestyle, all of those have a factor that increases the risk for obesity. But the greatest factor is genetics, and specifically epigenetics, those outside factors that influence the genes. So your DNA, everybody thinks it's a stationary thing, but there are genetics where you can express or suppress the expression based on um, your lifestyle choices, environmental factors. So basically, you have variants that are part of your DNA code that are there behind, just waiting to express themselves. And it's those external forces upon your genes that can make it either express or hide those genetic tendencies. And so the main factors as far as lifestyles in a nutshell are what you do as far as moving your body, how much quality sleep, food choices, the amount of stress or stress reduction, food timing, and supplements or medications that influence the genes and the genetic expression. So basically, this is just an example how some people have what they call the thrifty gene. It means those people eat something and they hang on to every single calorie, and that gets deposited as fat. So a change in the environment can expose that thrifty gene. So the factors that influence that genetic expression, as I mentioned, activity, sleep, food timing, food types, stress, vitamins, and some supplements. Okay, true or false? Calorie restrictive dieting is needed to reduce weight. Is that a true or a false statement? Do you have to starve yourself to get thin? Answer is false. You do not. And I'm going to show you a little study that I came across. This was way back in 2014. They had 10 patients, so this was a pilot study. And all these 10 people had documented dementia or Alzheimer's disease. And instead of a single approach, the researchers did a multimodal treatment approach where they did a very aggressive lifestyle intervention. And the results of that pilot study were that 9 out of 10 had a complete reversal of their dementia. And as a side effect of this aggressive lifestyle intervention, all subjects lost all of their excess body weight, body fat. The case example is a woman who's 67-year-old. This was one of the participants. She was a data analyst, and she was forced to quit her job because she couldn't remember even just four-digit numbers. She was diagnosed as progressive dementia. Her mother also had progressive dementia, and she had taken care of her mother until she died. And so she decided she was going to commit suicide because she didn't want to die the same way as her mother. So her friend actually talked her into enrolling in the study. So each person, including this woman, had a personalized intervention program where they looked at a lot of their medications, their lifestyle, their blood work. And her specific intervention program included an elimination of simple carbs, gluten, processed foods. She went from only sleeping 4 to 5 hours a night to 8 hours per night. She had a fasting program where she didn't eat 3 hours before bedtime and had a 12-hour break of eating between her dinner and her breakfast. She had a stress reduction program. She did yoga and meditation twice a day, and she actually became a yoga instructor. Her supplements based on her blood work were that she had three, vitamin D3, B12, fish oils, and CoQ10 as supplements. And then she exercised only 30 minutes a day, 4 to 6 days a week. Now, this is not over exercising, this is just moderate exercise. And we'll get into exercising and the recommendations for exercise and the sweet spot for exercise in a later topic. So her results, within weeks, she had complete reversal of her dementia. She returned to work and she had a 20-pound weight loss. And 6 years later, she still works and she continues with her lifestyle plan. It's interesting, many of these patients, if they got sick or they fell off of their program, would notice clear indications that they were having more problems with ability to think and think clearly. So wellness is achieved through lifestyle changes. And then perfect weight follows the lifestyle. So the point is not to be chasing the weight. The point is to be chasing health. So from this initial study, this pilot study, the author, Dale Bredesen, has a multi-center study. Now there's only over 3,000 participants in this study. So from his initial in 2014 publication, now he's produced a book, and the book End of Alzheimer's, a very good read. I recommend it. The First Protocol to Enhance Cognition and Reverse Decline. So he isn't the only one that's studying this multimodal approach. It's called the FINGERS program. That's an acronym, and it's across the entire world now. And it was initiated by the Finnish Geriatric Intervention Study. That's what the FINGERS stands for, the Finnish Intervention Study, to prevent cognitive impairment and disability. It again is a multimodal lifestyle. They're using a randomly controlled trial intervention program. And it's initiated worldwide programs to study dementia using a multimodal lifestyle intervention. So all of these countries, China, Australia, Europe, Singapore, South Korea, Japan, Spain, and more, they are all having ongoing trials of this lifestyle intervention to prevent and reduce dementia. So that's what this course is about, is looking at the rationale behind all of the interventions. But briefly, I'm going to go through some of it here. The diet program, reducing simple carbs, gluten, processed foods, has an effect of reducing systemic inflammation. And inflammation is what causes almost all diseases, including cancer, dementia. So the increase of glucose, elevated blood glucose with simple carbs, increases inflammatory cytokines, and these chemicals that are released in the body. And changing that food type reduces the blood glucose, prevents the insulin resistance, and insulin resistance is what develops with type 2 diabetes. And with that, reducing the risk for type 2 diabetes, you reduce inflammation that affects the brain in terms of dementia, and also reduces inflammation in the body that increases the risk for obesity, hypertension, heart disease, and more. Stress reduction, using yoga, meditation, alternate ways, mindfulness training. Stress is reduced. Stress actually reduces the hormone cortisol. Cortisol is your stress hormone, and small levels of cortisol are needed when your body, say you become hypoglycemic, or your blood pressure falls when you stand up too fast. So short bouts of cortisol, inputs of cortisol from the adrenal glands are helpful, but sustained elevated levels of cortisol are not. And sustained levels of cortisol are present with chronic stress, chronic worry, and the cortisol is directly responsible for creating insulin and leptin resistance. Leptin, as we'll get into in a couple more topics, is what tells your body that you're not hungry. So stress increases weight gain by increasing appetite. So with all that, with that stress, it also increases your food intake, increases weight gain, and becomes this cycle. Okay, sleep. The patient we're talking about increased from 4 to 5 hours a night to 8 hours a night. It's only during sleep that your body clears these beta amyloid plaques, and they're the things that are responsible for dementia. And your brain doesn't have a lymphatic system, it has a glymphatic system. And it's only during this period of deep sleep that the brain cells shrink, the cerebrospinal fluid flows between the cells, and all that metabolic waste is removed. Fasting, fasting 12 hours, a minimum of 12 hours with no food before bedtime enhances autophagy. And that auto means self-eating, where the cells kind of essentially cells that are getting old or degrading, they essentially eat themselves, and the byproducts are used for recycling. So you want this period of autophagy, or it's when your body is recovering, rejuvenating, clearing out its damaged cells, and coming up with a better self. Fasting is hugely important. So allowing time for that to happen is important and that's why you want to stop eating, stop with the digestion, and allow for this period of autophagy. Okay, the supplements, these are based on individual patient needs. For instance, when patients get older, they have a problem with pineal gland producing melatonin. So a small dose of melatonin about 30 minutes before bedtime helps get patients fall to sleep a little bit better. Other supplements, D3, B12, fish oil, CoQ10, these are replacement of nutritional deficiencies. And exercise, we'll have an entire topic on this. The goal of exercise is to reduce inflammation. So exercising muscle is releasing these myokines. They're anti-inflammatory cytokines. They improve leptin sensitivity, so they reduce the appetite. Now, I need to preface it by saying that exercise in moderate doses. Over-exercising, extreme exercising, actually increases appetite. So it's this moderate exercise that is the most helpful at reducing inflammation. And the recommendation is 30 minutes a day, 4 to 6 days a week. So speaking now to the students taking the class, my contributions this semester is that is going through an in-depth physiology of all these 6 factors, all these lifestyle factors that influence your genetic code. And we're going to be critically evaluating papers, research papers, and editing. I'm going to be editing your articles, and then we're going to be creating a book for this semester about those articles that you're finding and making clear recommendations for a book that gets created for this semester for special topics that students are interested in. So the contributions for the students is that they were going to participate in Kahoot, in the Packback discussions, a platform for topic studies, and weekly quizzes on these lectures that are presented. Writing the articles, researching it, reviewing each other's papers, and each of the students will have a presentation, PowerPoint presentations in class, and a final paper submission in preparation for the book printing. And this is the book that was created in spring 2021. The book turned out to be 100 pages, 7 chapters. These are all the individual essays of each of the students. And looking at, if you want to look at this specific book, there's a PDF that's in the Canvas pages. So it's paper writing, editing, all of this. We're going to be using Google Share to look at each other's papers and editing. And your topic choices, Google link will be posted. The topics will be divided into these 7 general topics: sleep, exercise, fasting / food timing, stress reduction, supplements, food, diet, and types, and then the special topics. For instance, one of the special topics was how to recover a patient that had amputation. So that will be posted. And then another Google Drive, this is where all the papers get posted, topics get, topic choices, outlines, rough drafts, and final versions. So in summary, we talked about epigenetics, how the environmental factors affect your genetic expression. We went through the wellness factors as an overview, and how we're going to create this book for fall of 2021. So wellness is a balance of all these forces that influence the self, all these environmental factors. All right, my disclaimer: the more I learn, the more I realize how little I know. So any questions, comments, please leave in the comment section of the YouTube, and there will be a PDF link for this and every subsequent presentations in the YouTube.